Hello, my name is Jane Haynes. I and my colleagues, Alice Blazek and Kathleen Spadaro, are registered nurses. We have expertise with lung transplant patients, intensive care, and mindfulness-based stress reduction. No one truly understands what you're living through, but we know some core experiences reported by those caring for a loved one who has had or is waiting for a lung transplant. It is financially, emotionally, and physically traumatic. You may feel powerlessness, fear, happiness, anger, isolation, and depression, sometimes all at the same time. The focus is on the patient, yet you are here as well. We have made these films to help you take care of yourself while you care for those you love. These films are based on the mindfulness-based stress reduction program developed by Dr. Jon Kabat-Zinn, a molecular biologist from MIT whose work on stress has helped thousands of people across 5 decades. To replace old habits, we need to practice. That is what the mindfulness exercises are for. One of the things that needs to be acknowledged from the very beginning is that you will be interrupted during your practice, during your exercises. Someone may be bringing in a lunch tray or need to draw blood. How do you cope with that interruption? What do you do? Get frustrated? Angry? Stop? Think about giving up? It is okay. I'd like you to take a deep breath when these negative thoughts rush into your head, and I'd like for you to acknowledge those thoughts, deal with the distraction, and when you can, return to your practice. Restart either from the beginning or from where you left off. There is no right way or wrong way. We are practicing being mindful in the present moment. Mindfulness is being fully aware in the present moment, non-judgmentally. The most important reason to practice mindfulness is that you will be present in every moment of your life. One of the phrases that you will find me using from time to time as I am talking to you about mindfulness is bringing your awareness back to the center. And what I mean by that is bringing your awareness back to your breath. Are you breathing in right now, or are you breathing out? So whenever you're distracted by either a bodily sensation or thoughts that you have going off in 50 different directions, what I'd like for you to do is to take a deep breath and bring your awareness, your focus, back to your breath. That way you will start to ground yourself back into the present moment, breathing in and breathing out. Why do you want to practice the exercises on mindfulness? There are many reasons. One reason is to control stress. Stress is something that we all experience every day of our lives. But the stress of caring for a loved one that is struggling is far greater than everyday life. You carry your own unique levels of stress. You're trying to care for and support your loved one. You need to be strong for that person and for others in your family. But what's left for you? Who is taking care of you? Mindfulness is a means to manage stress, to help you take care of yourself. Normally, when we feel like we're in danger, adrenaline pumps in our body so we are ready to either run or fight. Our muscles tense, our heart speeds up, and our brain is on high alert. Back in the caveman days, we would either be running away or throwing a spear with our arms to defend ourselves. Today, the adrenaline might help us swerve just in time to miss that car that's running a red light. The problem is, with the chronic stressors of the lung transplantation process, you often feel the adrenaline rush in your body and feel your heart pumping, but you can't escape or fight. Unfortunately, the effect of stress lingers. People under stress may suffer from headaches, muscle tension throughout their body, stomach problems, or they can have increased blood pressure and pulse. People often have depression, anxiety, trouble sleeping, they may lose their appetite, or they may eat all the time. Sometimes it's difficult to think clearly. So what do we as humans typically do when we're under stress? We may sleep more, we may drink more, we may eat more. We may have negative, self-critical thoughts, which can bring on a change in mood. We can be more irritable, which can increase our isolation. This is where mindfulness can come in. Research has shown that the practice of mindfulness actually reduces blood pressure, pulse, and respirations. It can decrease headaches and chronic pain. It helps people with cancer and other chronic conditions, improving sleep and mood. It helps people with cardiac conditions and stomach conditions, and those with depression, anxiety, eating disorders, and substance abuse. This is why we like to help people learn about and practice mindfulness. This is a powerful tool that you can take with you and use anytime, whether sitting in the hospital or at work. To begin, we want to recognize and choose to avoid mindlessness, the opposite of mindfulness. How often do you drive places and go into automatic pilot? You park your car and can't remember where. Or we come home from work, grab a bag of chips, sit down, and in 5 minutes that bag is empty. How much of our day is spent living our lives mindlessly? Mindlessness means we are missing important moments in our lives. The stress of a loved one in the hospital may easily lead to mindlessness, a lack of awareness of yourself. We hope to bring you back to yourself, to feel the moment, to know that you're in control of certain things, even when not in control of everything, to give yourself recognition for what you do. Two important aspects of mindfulness are non-judgmental awareness and patience. Awareness means awareness of what is going on around us and inside of us and how it is affecting us. We are bringing awareness to the present moment. We are bringing awareness non-judgmentally. We are not being critical. We are not doing negative self-talk. By negative self-talk, I mean you might be really hard on yourself asking, "Am I doing it right?" Or your thoughts may start to race because as you try to quiet down, your mind will start to chatter. Then suddenly you're thinking, "Oh, wait a minute, I forgot to put the milk back in the fridge. Did I pay that bill?" What you want to do when that occurs is to take a long, deep breath and recenter yourself with your breath. Be aware that those are just thoughts, and thoughts are like waves on the ocean. They come and they go. They ebb and they flow. If they are important thoughts, they will come back when you need them to come back. In the meantime, just take it all in and realize that right now there is a lot going on in your head, even if your body is still. To trust your own feelings with honor, to be yourself, being open and non-judgmental, so that you're being gentle with yourself and other people. We are observing what is taking place in the present moment without automatic reaction. Patient, non-judgmental awareness is beautifully simplistic and rewarding. It allows us to move forward instead of being concerned about the past. It allows us to make conscious choices, to see the moment for something different than what we experienced in the past, as opposed to coming in with preconceived ideas. The final two foundations of mindfulness that we are going to discuss are non-striving and letting go. We don't have to work so hard in life to try to fix everything or make everything better. This doesn't mean that you don't care about important issues. They are there and may or may not be under your control right now. Mindfulness allows us to let go of control. This is not about seeking nirvana or perfection. We can let go and be in the present moment and let the present moment come to us.